Hi, my name is Hannah Bauer, and today I'm going to be talking to you about the heart disease called coronary artery disease. This can also be known as CAD or coronary heart disease. First of all, what are your coronary arteries? Your coronary arteries are located on the outside of your heart, right here, and they are very important because they supply blood flow back to the heart so that way your heart can receive blood and continue beating and doing its normal function. It goes right along with the regular heart system. Blood will come into the right atrium, down into the right ventricle, and out to the lungs so that way it can become oxygenated. Once it's oxygenated, it comes back into the heart, into the left atrium, down into the left ventricle, and then after it leaves the left ventricle, it goes out to the rest of the body. We learned this in my last video too. After it leaves the heart and goes to the rest of the body, one of the places that it comes back to is these coronary arteries right here. If your blood isn't receiving the right blood flow that it needs, then it's not going to work properly. And if your heart doesn't work properly, that's really dangerous for your body. Okay, so first of all, coronary artery disease is a buildup of fat and LDL, which is low density lipoprotein or bad cholesterol, in the artery walls. So here we have a normal straw. You can see right through it, and it has really good, if blood were to go through this, it'd flow really well. I have an example of that here. We've got my fake blood here, and it's gonna go through, and you're gonna see it's gonna go through pretty easily. Just comes right out the end, doesn't have any resistance, and just flows. That is what a normal coronary artery would look like, or any artery in general. Next, we're going to show an example of what a coronary artery would do. So for this example, I have a paper towel stuffed inside, and this represents the fat buildup inside of the coronary artery. So you're going to see that blood is not going to be able to flow through it like it did for the normal artery. You can see that it's moving down a little bit, but it's taking a long time to get through, and it's barely dripping out of the bottom. So a complete blockage of blood to the heart is called a heart attack, and these are very fatal. Some causes of coronary artery disease are lack of exercise, diabetes or insulin resistance, smoking or tobacco use, and high blood pressure can cause this as well. Not just like short period of high blood pressure, but at like long periods. That it can be dangerous for your heart. So next we're going to be talking about how you could see coronary artery disease on an EKG. So first of all, this is a normal EKG. You can see you have your S, or your P, Q, R, S, and T waves here. So whenever I was researching this, I found that there could be lots of different EKGs, but one that I wanted to show here was VFib, which stands for ventricular fibrillation. Another type of EKG that could pop up whenever you have coronary arteries disease is atrial fibrillation, ventricle tachycardia, and there's a couple others too. But as you can see, there's no regulated waves. It'll take a minute for you to look at that. For ventricular fibrillation, it's all out of sorts, and there's no sort of wave, and it would be really hard. It pretty much means that you're dead. But this is what I have for coronary artery disease, and I hope that help you understand it more. Here is my source that I used for this video. Thanks for watching.